Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. This is Gil Lederman, Dr. Lederman at the ABC studios, live in New York. I'm here with John Taransky. Good morning.
Good morning, Doctor. How are you?
And good morning to all our listeners. We hope you are all well and doing great today and better every day. There's a lot of new there's a lot of new news and information that we're going to bring to listeners this day. New medical reports that came out this week. We're live, so for those who have questions about health care and medical issues and cancer, please feel free to call. During the show, our number is 1-800-848-9222. Again, that's 800-848-9222. So let us know if you have a question. There was a report that came out this week on robotic surgery. Do you know what robotic surgery is?
Yeah, Doctor. To a certain extent.
So robotic surgery, there's a company that makes a gizmo called Da Vinci. It has nothing to do with Da Vinci art.
Right.
It has nothing to do with Leonardo, nothing to do with this company. They ripped off his name, and it looks like they're ripping off some other things, too. The New York Times reported, and there was a report as well in the Journal for Healthcare Quality, that complications from robotic surgery procedures are vastly underreported, and therefore when people go in for surgery, they do not know the real rate of complications.
Right.
So why is it important? Well, it's important if you're going to get surgery with a device, and remember there's a person behind that device, and they don't accurately report complications, then you're choosing a procedure that you don't really know the risk of.
Right, sure.
So that the doctor cannot inform you as to the risks, benefits, and alternatives because they don't know the risks.
Right.
And there was a woman named Erin in 2009. She was in her 30s, a young woman. She had endometriosis. She was supposed to have a little operation for endometriosis. The operation lasted 11 hours. 10 days later, she went to the emergency room. She had been torn in her rectum and her colon. She was hospitalized for 5 weeks. She had multiple surgeries. She had a colostomy. Of course, she's suing her doctor.
And this was all because of the robotic surgery?
All due to the robotic surgery. And there's a regulation by the FDA that within 30 days of an incident or learning of an incident, the company's supposed to report that incident to the FDA.
Sure, that makes sense.
So here's a woman that tears in her rectum, tears in her colon, multiple surgeries, 11-hour operation, 5 weeks in the hospital, and guess what?
What's that?
The company never reported it to the FDA.
Really? Now, why is it that the robotic procedures, these reports are inaccurate or just not reported?
Well, probably because people don't like to report bad results.
Right, negativity, correct. Yeah.
And there's been a lot of complications. This Da Vinci system has been on the market for a decade. There's been 1 million procedures, the company says.
Right.
So they report the procedures, but they can't report the complications. And it said in the New York Times that between January 2000 and August 2012, there's been thousands of mishaps that have been reported, but that the vast majority actually have never been reported. So doctors don't really know what percent the complication rate is. This is really important for men with prostate cancer. Men with prostate cancer are choosing robotic surgery more than anything else. And you can say, well, the surgeon does the biopsy, and then the surgeon may push the man to have surgery rather than to know about all the options, which morally we're obliged to tell people about all options, whether it's going to be surgery, open surgery, robotic surgery, various forms of radiation, brachytherapy, or even no treatment.
Right.
So sometimes it's a bit when you go like to the dentist, and the dentist says you have a cavity, and the dentist charges you to fix the cavity, and most people don't go for a second opinion for that cavity, but really they're breaking up the enamel and breaking up that tooth, and you hope it's all true. And so in prostate cancer, robotic surgery is the most commonly chosen method of treatment. Now, it's not the best, and we're going to talk about the data in a few minutes, but the FDA and researchers at Johns Hopkins are saying that the adverse effects associated with Da Vinci are, quote, vastly underreported. And the president of the National Research Center for Women and Families said that the known reports are only the tip of the iceberg of surgical complications. So why is the concern? Well, the concern is obviously how can you get a true informed consent if you don't know the real complication rate?
Right.
And you might expect that. If you think about it, with open surgery, the surgeon's hands are inside your belly or inside your pelvis, and he's feeling things. He's feeling the rectum, he's feeling the colon, he's feeling the prostate, he's feeling the bladder, which all has to be separated out. With robotic surgery, you've got mechanical hands in there.
Sure.
And how does a mechanical hands feel? I mean, you don't feel the same way.
Know, yeah.
So there's this new study follows a series of reports that have been critical of robotic-assisted surgery. And there's multiple legal actions against this company that makes the Da Vinci device. And they have accused them of having aggressive tactics. This is quote-unquote from the New York Times, having aggressive tactics to market the equipment. And they raised the question of the quality of the training provided to the surgeon and the pressure on the doctors and the hospitals to use it. Obviously, hospitals spend millions of dollars to buy the equipment, so they want probably
doctors
to push the doctors.
Sure. Right.
And it seems like doctors sometimes don't even want to use it. The device costs several $1 million. They've sold 1,400 of them, so you can multiply 1,400 times, let's say, $2 million, and you're talking about billions of dollars. So it's a huge industry. And an associate professor at Johns Hopkins said this expansion of robotic surgery has occurred with no proper evaluation and monitoring of the benefits. And it's the same doctor said the whole issue is symbolic of a larger problem in American healthcare with a lack of proper evaluation of what we do. We adopt expensive new technologies, but we don't even know what we're getting for our money, if it's good value or if it's harmful,
right.
He said. And there was an anonymous survey of doctors who used the Da Vinci in 2010, so recently, and 56% said they had irrecoverable operative malfunctions when using the Da Vinci system. 56%. So the doctors had experienced malfunctions of the system.
More than half, yeah.
So you're talking about, number one, underreporting complications. You're talking about new technology. And you're talking about technology that doesn't appear to be better than old technology. So it makes you wonder why people are getting robotic surgery. There's another study from Harvard Medical School that looked at men who had open surgery versus robotic. And the people who said they had no problem with controlling their urine after surgery for prostate cancer, less than 20% had no problem with open surgery, and only 13% had no problem with robotic surgery, which means 80 or 90% of men going through surgery for robotic removal of the prostate have complications controlling their urine. And this is after the procedure. So you're talking about 80 or 90% of men having complications with controlling the urine and sexual function. Guess what percent of men were normal sexual function after robotic surgery?
Normal after robotic surgery?
Mm-hmm. It's supposed to be great because you can see everything.
Sure,
and there's lenses and cameras and lights and mechanical hands. Guess what percent of men are sexually normal after robotic surgery?
I'll take a guess here. Let's go 39%.
2%.
2%. It's way off there.
2%. And then the question is, okay, what's the chance of being cured with surgery? And let's just say you have a typical prostate cancer, the most typical in America. Your PSA is 4 to 10, between 4 and 10, your PSA, your blood test. If you have surgery, the chance of success is 76%. If people came to